Hello everyone, Bill Lovelace with Long Beach Local News. Today I have the pleasure of meeting with Denise Anderson, Managing Partner of J. Johnston Insurance. And she's here to talk about open enrollment of Medicare, which is coming soon. Welcome.
Thanks, Bill. Happy to be here. Yes, open enrollment is beginning on October 15th and will run through December 7th. And 2025 is going to be kind of a pendulum of change year for Medicare. We're going to see quite a few changes to prescription drug coverage and also some changes from the carriers as far as the products they offer and the coverages that will be included. Initial enrollment is sometimes very overwhelming. There's tons of rules and regulations in regards to Medicare. And we find that a lot of people, once they've enrolled in Medicare, tend to have an approach to set it and forget it. The problem with that approach is that as time progresses and the policies change, and also health needs can change, we find that people are in the wrong plans or potentially paying a lot more for their health care coverage than they need to.
Now, how do you ensure that your clients get the most out of the Medicare plan?
So the federal government initiates changes to Medicare pretty much on an annual basis. And then once every blue moon, we will have some legislature that also affects Medicare benefits. So what we do is we keep our clients up to date on what those changes are, kind of in a Cliff Note version, if you will. I don't need you to be an expert on the changes. I just need you to understand how they might impact you. And then we encourage our clients to participate with our annual plan review. A plan review is pretty simple for the client. They're going to provide us the updates that are important to them. So if they've had a doctor change, a prescription change, or a new health concern, and then we will do all the heavy lifting. We're going to roll up our sleeves and we're going to check and make sure that the plan that they're in best suits their both financial and health needs for the coming year.
Denise, can you give us a brief review on all the changes that are coming up in 2025 with Medicare?
Sure, Bill. So this year it's a little bit more extensive than years in the past. So the Inflation Recovery Act, which was initiated or signed into law in 2022, had some carve-outs for Medicare prescription drug plans. And on the positive side, it will change the way that a prescription drug plan works. Today it's very complicated. We have 4 coverage phases, and most people can't figure out which phase they're in from month to month or across the year. Next year, there will be a spend limit for Medicare beneficiaries. So their max out-of-pockets, what they pay at the pharmacy, will be capped at $2,000. But that does restructure the way that the health plans are administering the benefits. So we will see quite a few changes, one, on the products that are offered. We are expecting to see some consolidation, so not as many plans offered. And the formulary, which is the list of drugs that are covered by the plan, may also be changing. A lot of people refer to their drugs as generic, and we know what a generic is, right? It is the generic version of a brand name drug. So meaning multiple manufacturers might make that drug now. But just because it's a generic doesn't necessarily mean it will remain on a generic tier. So on a formulary, the tier tells us how much we're going to pay for it. And sometimes when these changes take place, we see those drugs move across several different tiers. So it's really important for folks to understand that changes are coming. Some will definitely benefit some of the population, but there also may be some surprises, and we don't want those to take place on January 1 once open enrollment is closed.
So Denise, what would be a good age to start planning for Medicare?
Planning for Medicare typically begins when somebody's about 64 and 6 months of age. I actually like to have a conversation with folks a little bit earlier, about 63, because there are some financial decisions that people are making approaching retirement that can affect and impact what your Medicare Part B premium is. And let me just touch on that for a minute, Bill. Most people feel like they've paid in enough taxes, and we probably would agree, that Medicare, the perception is that Medicare is free. Unfortunately, Medicare does have a Part B premium that will impact you for the rest of your life. So I actually like to have a quick conversation with people so that we can begin road mapping, because at that point in time, people may be making some financial decisions preparing for retirement. And then getting the timing right. So we have about 7 gotchas that we've identified with Medicare. And the big gotcha, if you will, is timing. If you enroll in Medicare at the wrong time, you could be facing significant financial impact. And that could be 1, paying too much for your health insurance, or 2, missing an enrollment deadline and also having lifetime penalties. Yep, lifetime penalties. I see you shaking your head. So if we miss an enrollment period and we don't enroll in Medicare when we're first eligible or when it's appropriate, there's penalties that are assessed for Part B, which is your medical coverage, and Part D, which is your drug coverage, and those will last for the rest of your life. So it is important to meet with someone to kind of roadmap your timing to make sure that you do not wind up putting yourself in a position where you're assessing yourself some additional penalty dollars. You know, there's a do-over with everything in life. Even if you misfile your taxes, you can refile them. You don't get a do-over with Medicare.
So Denise, if someone wants some really good guidance, how do they get a hold of you?
Sure, Bill. So they can either call us directly to the office, 562-795-9201, or they can reach us on our website. It's www.j, the letter J, the word Johnston, Johnston Insurance, or at our sister site, makemedicarework.com. We have some really good resources available for people to help start road mapping their Medicare. And then, of course, we're always available for a phone call, face-to-face, or web meeting to make sure that their roadmap is solid. And we know life changes, so you know, sometimes when life throws you a curveball, it gets a little overwhelming. So we always welcome people to give us a call, and we'll help get them pointed in the right direction.
Fantastic. And so what we're going to do on the description of this video, we're going to put links to your website. Put your phone number down also if you guys didn't catch that at home.
Perfect.
Denise, I want to thank you so much for joining us and giving us a little insight on Medicare. Look forward to talking to you in the future about my Medicare.
Be happy to help you, Bill. Thank you so much. Appreciate your time.